Hey, Dr. Pack, are you ready for this?
Yeah, I'm ready.
Okay. Hey, it's good to see you. Good morning.
Hey, how's everyone? Everyone safe?
We are safe and happy.
Wonderful.
Plus, we all have coffee, and so we're in good shape overall. So let's talk about this. We have Dr. David Pack on from Pack Medical Group. The guy has done pretty much everything medicine-wise. So I'm gonna go ahead and go out on a limb here and call you smart enough to be a doctor and amazing enough to be an expert. So
I
thanks for
doubt
coming
that,
on
but
with us today. He's going to tell us about the future of medicine and medical care. Because I guess my point would be, if 2020 taught us anything, it's that everything changes, everything's different now. So I thought it'd be good to hear from you. What you've seen come out of 2020, and then going forward, what are you seeing as the future of it? I think you're already doing a lot of cool stuff anyway. So maybe you can share with everybody what you're seeing as coming up.
yeah. So I thank you everyone for joining us today. I appreciate the opportunity to kind of engage with the chamber. As you know, we love the chamber here in New Braunfels. You're such a vital part of the community, and anything we can do to kind of align with your vision and how we can make our community better, I'm all for it. So I've been a huge fan of telehealth since 2008. I just think this day and age of trying to think that healthcare can only be provided in confines of four walls, I think those days are gone. And I think COVID has accelerated the power of telehealth. What I would actually request is, if possible, I would like to do another at some point where I want to do an actual demo when everyone's more comfortable of actually congregating in one facility. And the demo would be very, very powerful. We're able to do virtual physical exams. We can do virtual EKGs. We can basically do almost anything virtually now. And there's more and more wearables out there technology-wise. But I think it goes more to what's happening in the healthcare market. As I'm sure you've already seen, the healthcare market is massively consolidating, and that consolidation process is going to accelerate. And you haven't seen anything yet. So what you're going to see is bigger healthcare entities get bigger, and there's many reasons for that. But the one major reason is the way that reimbursement is going to be handed out in the future. So currently, for the longest time, healthcare has been reimbursed by what we call fee-for-service model, and what I call, the Pavlovian dog kind of thing. You push a lever, and then you get a treat. So when a patient comes in, you show your insurance identification card, you get a copay, you pay your copay, and then after the visit, typically we'll send a visit note and a billing for that reimbursement. So basically, it's what we call fee-for-service model. So you get paid every single time that you go in and see your physician or specialist for the visit. Then, of course, you get paid for the procedure if they do any procedures. So fee-for-service is very much volume driven and procedure driven. That's how the reimbursement model happens. And so what's changing now is they're really promoting bundle payments and what we call value-based care. So a lot of the bigger pyramids are going to start paying physician groups for what I call outcomes or metrics. So healthcare is like any other industry. It's now becoming very much data-driven. And so what they're looking for is a network of physician groups, and they're basically going to say, okay, this group of physician groups versus this group of physician groups, show us your data in regards to how well you manage blood pressure, hemoglobin A1Cs for your diabetics. For surgical groups, tell me, your outcomes for total hip replacements, knee replacements, those kinds of things. And then the groups that have the better outcomes and lower costs, those are the ones who are going to get awarded contracts. And that's what's going to happen quite rapidly. And, a lot of times you hear the term capitation, but it's not really capitation. The old days of why capitation model failed, capitation in the older model was where a doctor or doctor's group would get a panel of patients. So let's say you had 1,000 patients in that capitation model, and you would get paid like $10, let's say, per member per month. So whether you saw the patients or not, you would still get $10,000 every single month for those 1,000 patients. So why that model failed was that there was no incentive for the physicians to see the patients because they got paid whether you saw the patient or not. And what they found was that the reason why that model failed was when they didn't see the primary care physicians, what ended up happening, it actually cost a cost curve went up because those patients eventually sought their care from emergency rooms. They have more hospitalizations and so on and so forth. And so now the newer model is like, okay, you will get your panel of patients, okay, but you will also have a very specific, what we call a report card or metric card, how well you manage those patients. And then on the back end, you will be able to get reimbursed for cost savings. So if you manage your patients really, really well, you keep them healthy, you keep them home, you do all the preventative measures and so forth and so on, then what ends up happening is there's a bucket of money that you saved because that money then go into emergency rooms, hospitals, and post-acute care, and then you're sharing the cost savings. Does that make sense? So it's a totally different, it's a totally different model. And Medicare is doing this. They're really pushing this. They've been pushing this for a while now. And if you follow the pattern, all healthcare payers follow Medicare eventually down the road. And that's why you're seeing all this massive consolidation in the healthcare space, because they're trying to build their network so they can compete for the bundle payments. Does that make sense?
Yes, it does. Yeah, for sure.
And then the other big part that we're kind of having difficulty with is data, right? Ultimately, what we're hoping for is something called HIE, Health Information Exchange, where we're able to push all the healthcare data to a large cloud space. And then, we're able to kind of access it. So whether you go see Dr. X here, if you see Dr. X in Austin, Dr. X in San Antonio, Dr. X here in New Braunfels, it'd be really nice to be able to go and with some healthcare navigation system, you can access a patient's records. So, originally the model would have been very similar to how if you went and got, let's say you want to go and get a car today, automobile, right? Or you want to go and get a mortgage. Well, you would have to give your social security number, right? And then they would type in your social security number, and then they can look at your credit score and all your debt and all that kind of stuff. So it was going to be very similar to that, where you would have having a healthcare ID number, or very similar to that. So basically, if you give us your healthcare ID number, you're basically giving us permission to access your healthcare data. Well, that's been a very challenging problem for everyone because of there's this very challenging law called HIPAA, and it's been that needs to be revisited. And I think it's in Congress right now to modify that, because that put a lot of barriers in place of trying to get that health information exchange. But ultimately, that's the goal, is for all of us to have a big healthcare repository, and then we use healthcare navigation tools. So whether Michael goes sees Dr. So-and-so in, Scott and White, and Dr. So-and-so in San Antonio, we should all be able to have access to the same data. So we're looking at the patient exactly the same way. And that's one of the big barriers that we're having right now, is that we're not able to exchange information freely. And, so we're basically practicing in silos, which is not very effective. It's extremely inefficient. So one of the biggest things that I think you're going to see is that you're going to see a lot of really cool healthcare navigation tools. Because for example, if I enter into a patient's chart, once we eventually get to a health information exchange, there's so much data out there, right? And I'm not going to want to access all of it at one time. I need a healthcare navigation tool that tells me, well, I want to look at Michael's most recent chest x-rays, or I want to look at his most recent labs, or I want to look at his most recent stress test. So you need to have some kind of healthcare navigation tool that can discreetly, in real time, efficiently give me the information that I need. So there's a lot of really cool things that's being done right now.
Dr. Pack, on that front, can I, as a patient or consumer, can I get access to my own records and bring them to another physician? Is that possible in lieu of being able to have it be on an exchange somewhere?
Yeah, I think ultimately that's the goal, right? Because ultimately, I say this to my patients every single time, like, who's in charge of your healthcare? And sometimes they point to me, and that's the wrong answer. Actually, you are in charge of your healthcare. And I think the goal for all of us in the future is to empower every single consumer or the patient to really take control of their own healthcare, right? And it's really interesting because if you look at healthcare is very unique in so many different ways, but one of the biggest things that it's difficult to kind of wrap your head around with healthcare, because every major healthcare company is experimenting with AI, artificial intelligence, to optimize healthcare, right? And for AI to work, you have to have some degree of predictability. It has to use logic. It has to use reasoning. That's what it's bases on. And so a lot of times, unfortunately, for healthcare, it doesn't work that way, right? Because human beings, in many ways, especially with healthcare, we're not very logical. So for example, a diabetic would eat ice cream. They clearly understand that when they eat ice cream, it's not good for them if you're a diabetic. So that's the part that they don't get, is that when you're dealing with human behavior and related with healthcare, a lot of times we don't function in very logical, reasonable ways. So they're trying to work on how to put that into the AI platform. And so the reality is that healthcare is very intimate. It's relationship based. And when you try to do it when you try to scale it in a large scale in healthcare, there's very unique challenges. And nothing could be more exemplary than, I don't know if you remember, there were Amazon, Berkshire Hathaway, and JP Morgan Chase. They had this huge initiative in the healthcare initiative 3 years ago. And, these are three titans in their space, and they just called it quits this year because they just couldn't make it work. And I think that was, if you read the articles that I have, some of the major reasons why they haven't, I think is because they haven't learned that healthcare is very personal. It's not like you go to Amazon and you say, well, I want this belt with this shoe, and click, click, click. It doesn't work like that in the healthcare space. And so healthcare is a lot more complicated than people think. And a lot of that is driven by human behavior and emotions.
I ordered a knee replacement from Amazon. It didn't come in 2 days. So I get you on that.
I know. I think logistically they bring a lot of great things to the table, but that was an eye-awakening experience. You had three really amazing companies that are icons in their space, and they just couldn't make it work. So they turfed it, and they're revisiting the Blackboard, and I followed them very closely, a lot of the articles, and I learned from them. But I definitely do think at the end of the day, healthcare is very personal. It's a very personal experience. It's a relationship-driven industry. But at the same time, I think we have to leverage technology to enhance value. And you use the word consumer, and that's absolutely true. That's the biggest, I think, pivot that's going on right now, is that consumerism is now invading healthcare. And now, as you can see, what's changed dramatically is that healthcare companies are marketing directly to the consumer through TV ads, through internet ads, so forth and so on. And so, a lot of physicians don't like that because it can actually cause some miscommunication. Like, we have patients come in asking for certain medication that has nothing to do with their condition because they saw a TV ad. And so a lot of it is about education and really sitting down with your patients and having that one-to-one discussion. But overall, I think we're in the precipice of a huge paradigm shift in healthcare. I, for one, I'm a big believer in it. I think it's a great idea. I think healthcare needs to be where we get, as physicians and healthcare organizations, I really do think we need to be held responsible for our outcomes, right? At the end of the day, I think the consumer should be able to choose and say, look, this physician group, look at their metrics in regarding patient satisfaction, their infection rates, of all these healthcare outcomes, I think they should be shared. I really do. And I think we should display it to the public and say, you know what, if you're doing a better job managing patients than I am, then I think we should be rewarded for it. And that's where healthcare is going, is that ultimately healthcare groups are going to get report cards on different metrics, and that's going to be basically for public knowledge. And then the consumer will have the option to choose what they think is best for them.
For us as patients, I think that's pretty awesome. You mentioned personalized, being more engaged as a physician. How do you do that as a physician with telemedicine? Do you see that? That to me, I'm just guessing that telemedicine would be the future. And we have our own devices. You said you can do remote EKGs and things like that. How do you, as a physician, maintain that personal touch?
Yeah, so I think it's a combination of both. I think there's many things that you can deliver by telehealth. That makes perfect sense. So, for example, behavioral and mental health is a great platform that you should be able to deliver for health, for mental and behavioral health. So one of the big initiatives that I have with our IPA, Zenith Independent Physicians Association, that we created, we have about 240 clinicians currently signed up under our IPA. And a lot of the physicians that are in our network, they're in areas that are challenging, like Laredo, the Valley, Eagle Pass. And it's unfortunate because those patients don't have access to specialists that they deserve. Because if you're a specialist that are in demand, so for example, you're a specialist, you're a psychiatrist, or let's say you're a rheumatologist that are really, really high in demand, you can basically go wherever you want, right? You can go to San Diego, you can go to Austin, you can go to Dallas. And so the reality is, if you're in high demand, you're really not going to seek a place like Eagle Pass when you can go anywhere you want in the country, right? And so for me, I'm very passionate about that. Just because where you live, I think it doesn't just because you choose to live in a place where you grew up and your family, I think you should have access to just as good as healthcare as somebody who lives in Austin or Dallas or San Diego. And the way to do that is leverage technology. And one of the ways you can do that is through telehealth. So one of the big initiatives that I'm taking on right now is to deliver behavioral mental health support to those communities through telehealth. And that's the power of telehealth. Another thing that you can do is, if you think about it, wearables all have Bluetooth capabilities now. So there's something called remote patient monitoring that we actively use in our practices. So a lot of our patients that are not well controlled. So I can monitor your glucose, your weight, your heart rate, your blood pressure, and your oxygenation from our office. And so, a lot of our patients that have chronic conditions, that have congestive heart failure, they're on dialysis, they have uncontrolled diabetes, we manage them remotely from here. So the answer to your question is the personalization comes from relationships. That's one of the things I would like the opportunity to do another demo, a live telehealth demo, where I will do a visit where we can do a virtual physical visit with our nurse, with a patient, and then we can have another physician on board, and then we can have a concerned son or daughter from a different state come all under a multi-point connection on our telehealth platform and do one visit in one room. And you can see the power of telehealth in that demo. And it's more, it's a very powerful tool. But I think you have to do two things. One is that you leverage telehealth when you fill in gaps between visits. But then also, it's really important to have that one-on-one visit, an actual physical exam, at least once a year, to get head-to-toe physical exam and have that visit. So you have to combine both telehealth and a real physical exam.
One quick question for you, then we'll open it up for the crowd. You said a remote EKG. Do you ship a device to the patient at that point, or is this something they would have already?
Yeah, so right now we do that. So again, this is a prime example of value-based model versus fee-for-service, right? So a house call, it doesn't make sense for physicians in a fee-for-service model to do a house call, right? Think about it, because by the time I pack up my bags, like Marcus Welby, get in my car, drive to your house, and see you at your home, and do a physical exam and do all the things and document and then come back to my office, I can see, multiple patients during that time, right? So it doesn't make sense from a business model perspective in a fee for service model. That's why that model is flawed. Fee for service model, you're managing the visit, not the patient. You're rewarded for managing the visit, not the patient. In a value-based model, and the ultimate value-based model is a fully delegated contract. What that means is we get a panel of patients and then we get paid managing the entire patient, right? And so for me, if a patient is ill and they don't feel good and they have transportation issues and they can't come in a value-based model, it makes sense for us to do a house call for that patient, right? And actually go there and see them at their home and try to take care of them at their home if it would save an emergency room visit and even one bed day at the hospital, right? Because in that model, it's about saving costs rather than actually generating revenue. So the incentives have to be aligned, because if it doesn't, then ultimately that drives behavior. Does that make sense?
Yeah, yeah, for sure. Thanks. Questions from anybody watching? Go ahead, Steve. You're cutting out, my friend. Sorry.
Can you type in the question?
Yeah, maybe send it on the chat. See if you're cutting out a little bit. And
yeah, let me go into the chat.
Anybody else have a question? If not, I have one more.
Yeah.
So, Dr. Pack, I see commercials and I have an iPhone. I see all kinds of apps and all that sort of thing. Does that integrate with your telemedicine at all, or is it a completely separate system a person would use? Is that stuff legitimate when it comes to what you would need to know from a patient?
Yeah, that's a great question. So that's one of the other big issues right now in medicine is how do we integrate everything? So I'll give you a prime example. Telehealth is very inefficient in the fact that if I like kind of all the different telehealth platforms, I still have to have a separate EMR system that I have to document, right? And that's what the race is going on right now, is that every single EMR company, all the top level EMR companies like NextGen, Epic, Athena, all the high, top tier EMR system companies are trying to either buy or create their own telehealth platform. Because if you think about it, it makes perfect sense, right? The worst thing is to have different data points to, using different technologies, and then you have to re-enter that data into your EMR system, right? Ultimately, everything has to flow into your EMR system. So that's the big challenge right now, is how do we integrate all the different technologies to your EMR system, because that's the key, right? And ultimately, that's what's going to happen. So people like Google and Apple and all the tech companies, they're designing that system right now. I mean, they have to get into healthcare because it's a multi-trillion-dollar industry, right? And believe me, they're all going to get into it. So Apple very soon will come with healthcare application attachments. They're working on it. I've seen some demos. So through the Apple, and also, Google's doing it on their Android. There's going to be a lot of really cool things that you're going to be able to do. So everyone's trying to chase the same thing. So they're trying to do a lab that can be done through your phone. They're doing EKGs, some other technologies through their cell phone. And that's where the future is at right now.
Yeah, that makes sense. I mean, it seems like a lot of what you're saying is technology and then the market coming together, to kind of work out some of this. Like, I think we're in a like you said, a race right now to where it seems like everyone's competing, but then there'll be some that emerge, is what it sounds like you're saying, or it'll all kind of start to work together at some point, but we're not quite there yet, is what it sounds like to me.
Yeah, there's some really cool technology. Like Google's working on contact lenses. And I don't know if you know, but your tears have very similar to your plasma. So like it can your tears can measure your glucose, your sodium, some of the other electrolytes. So Google's already working on that. I'm pretty sure that's going to come out pretty quickly, that even your contact lenses can send data to a computer. So there's some really cool things coming out.
That's pretty awesome. That's pretty awesome. Um, Dr. Pack, we end at 10:30, so we got to wrap it up. You said you want to come back, and so what we'll do is take applications for people who want to get examined. Justin Meadows, I don't know if we have time to have.
Yeah, I did. If you don't mind, I did get a couple of questions that are kind of important. So the cost savings from doctors that are properly managing their patients, you said the money goes to the ER. With that being that case, should we expect ER costs reducing? No, actually, the money. If I misspoke, I apologize. So the cost savings is by avoiding unnecessary emergency room visits, avoiding unnecessary hospitalizations, those kinds of things that's how you get cost savings. So a lot of patients, when they don't have access to good healthcare, unfortunately, they use emergency rooms as their primary care, and that's a really flawed model. How does concierge care fit into the telemedicine model? Well, it depends on your concierge doc. I mean, really in a concierge kind of environment, it's up to the physician, the concierge physician, to deliver care to their patients the way it's all about the contract, how it worked out. So telemedicine, like in any other healthcare navigation tool, is only as good as what it's meant to be. So, telemedicine works really well to fill in gaps in care, but it's not the total answer.
Yeah, it sounds like you were saying that should be an and as opposed to an or situation on that.
Correct. It's an addition. Absolutely.
I'm kind of excited for your offer for next time. So we'll have to have you back on. Thank you for offering to do that, to do a telemedicine visit. I think that'll be I've never done one, so I would enjoy watching that. So
yeah, I think it will be an eye-awakening experience. I mean, the technology has dramatically increased, so I would love to be able to do that for you.
I think that'd be fun. So like I said, let me get a hold of Phyllis if you're interested in that. We got to wrap it up today. I want to thank Troopers Coffee
for
our coffee today. Thank you, Dr. Pack, for your time and expertise and all you do for our town and everyone here. So you all have a great day. Thank you, and we will see you next month. And we'll work on getting the patient in for you, Dr. Pack. Thank you. Bye, guys.